Feel your hands grow warm and your energy rise before you even finish one glass. Sounds impossible, right? I'm Dr. Justin Keller. In this video, you will discover why men over 60 lose circulation and the early warning signs you need to notice. A simple cold drink that opens your blood vessels in as little as 7 minutes. How each ingredient, beet, lemon, ginger, and cold mineral water, works in your body. The exact recipe, timing, and safety steps so you feel the boost without side effects. Stay until the end because the first step in making this drink is the part most men skip, and it decides whether you feel the warmth or nothing at all. Type your city in the comments so we can see where men are reclaiming their circulation. And if you value straight talk on aging with power, hit the like button and subscribe to Glowing Age now. Let's get your blood moving. Why male circulation slows down after 60. You might feel it when you stand up too fast and get lightheaded, or when your hands stay cold while everyone else is fine. Or maybe it shows up in the bedroom. Things take longer, feel weaker, or just don't respond like they used to. Those aren't isolated issues. They're symptoms of one root problem, slowing circulation. And for men over 60, it's one of the most important signals the body sends. I'm Dr. Justin Keller. What I see in men this age isn't just fatigue or lower drive. It's blood flow that's not keeping up. And that matters because circulation isn't just about heart health. It's what fuels everything. Your energy, your mental sharpness, your ability to recover, and your confidence behind closed doors. So why does it slow down? The first reason is loss of nitric oxide production. This is the molecule that tells your blood vessels to relax and widen so that blood can flow freely. You made plenty of it in your 20s and 30s. But after 60, your natural production drops, sometimes by more than half. That means tighter vessels, slower flow, and less oxygen delivery to your brain, muscles, and other vital areas. The second reason is endothelial aging. The endothelium is the thin layer lining your arteries. When it's healthy, it expands and contracts easily. But with age, and especially with inflammation or poor diet, it stiffens. That stiffness leads to higher blood pressure, poorer circulation, and less flexibility where it counts. Now add in a drop in testosterone, which impacts muscle tone and vascular function. Testosterone supports the health of the inner artery walls. When it drops, your vessels don't perform as well. And low testosterone also contributes to fatigue, lower libido, and even insulin resistance, which can damage circulation further. There's also the issue of reduced muscle mass and movement. As men age, many become more sedentary. Less movement means less muscular pumping of blood. Your legs act like a second heart. They push blood back up to your core. Without regular walking or resistance training, circulation stagnates, especially in the lower body. And don't underestimate hydration and diet. Decades of eating processed foods, high sodium and low nutrient meals start catching up. Your blood thickens, inflammation rises, and arteries narrow. On top of that, many older men don't drink enough water. Even mild dehydration thickens the blood and makes your heart work harder to move it. Stress is another major factor. Chronic, low-grade stress causes the adrenal glands to release cortisol, which tightens blood vessels and raises blood pressure. It also lowers nitric oxide availability and contributes to inflammation. So if you're carrying around unresolved tension, emotional or physical, it directly affects circulation. Lastly, medications. Many men over 60 are on 2 or more prescriptions. Some of these, like beta blockers, diuretics, or statins, can lower nitric oxide or blunt the body's normal blood vessel responses. These drugs might be necessary, but they also contribute to the decline in natural circulation. The result, you feel slower, colder, more fatigued. You don't recover like you used to. You might notice more stiffness, more forgetfulness, and more hesitation during moments that used to feel automatic. That's not just age. It's blood not reaching its destination fast enough. But here's the part that matters. Circulation can be improved, even after 60. You just have to give your body what it no longer produces on its own. And sometimes, it starts with something as simple as a glass of the right drink. In a moment, I'll walk you through a cold, natural blend that supports blood flow within minutes, and why it works better than you might expect. Signs you need to take circulation seriously. Ever sit in a warm living room but feel like your toes are wrapped in ice? That mismatch is your first red flag. Cold hands and feet are classic markers of sluggish blood flow. When the body can't push warm blood to the extremities, it saves the best circulation for vital organs and leaves the edges to fend for themselves. If your spouse complains about your cold feet in bed, don't shrug it off. It's your arteries whispering for help. Another overlooked sign is needing extra recovery time after even mild exertion. You climb a single flight of stairs, reach the top, and your thighs burn like you've run a mile. That isn't poor fitness alone. It's muscles starving for oxygen because blood arrives too slowly and leaves too much waste behind. When healthy vessels expand, they deliver fuel quickly and sweep away fatigue chemicals just as fast. Watch your brain, too. Losing a word mid-sentence, forgetting where you set the keys, reading a page twice before it sinks in. Those moments often arise from tiny dips in cerebral blood flow. Your brain is only 2% of body weight but demands 20% of your blood supply. Starve it for 30 seconds and clarity fades. Restore flow and thoughts snap back into focus. Sleep tells the story at night. If you wake up twice or more to use the bathroom or turn to ease leg cramps, poor circulation may be sabotaging rest. Slow flow means less oxygen to tissue, so your legs ache and nerves misfire. It also means your bladder lining gets irritated, sending false urgency signals even when it's not full. Men notice another sign in private moments: softer, shorter, or unpredictable erections. Penile arteries are the width of a strand of spaghetti. They're often the first to feel plaque buildup or endothelial stiffness. What happens there is often a 5-year preview of what may happen in the coronary arteries. Ignoring those changes is like ignoring a smoke alarm in the basement. Take a look at your nail beds. Healthy pink nails turn pale or even bluish when circulation falters. Squeeze the tip of a finger, let go, and count. Color should return in less than 2 seconds. Longer refill time means slower microcirculation. Temperature swings count, too. If you overheat easily during light activity but then cool down excessively during rest, your blood vessels aren't regulating diameter well. That poor thermostatic control signals endothelial fatigue and low nitric oxide reserves. Finally, consider emotional flatness. Studies show that restricted blood flow to the limbic system blunts joy and raises irritability. Patients tell me they're just not interested in hobbies or conversation. When we improve circulation, color returns not only to their cheeks but to their personality. Each of these signs feels small in isolation. Together, they build a clear picture. Your vascular system is losing elasticity and speed. The good news? These signals appear long before irreversible damage. Listen now, and you can respond with targeted nutrition, movement, and a simple 7-minute drink that jumpstarts nitric oxide faster than most drugs. In the next segment, I'll break down the science inside that drink. How a handful of everyday ingredients can open vessels in minutes and leave you warmer, sharper, and more confident before your coffee even cools. What makes this drink work so fast? Picture a traffic jam suddenly clearing because every lane opens at once. That's what the right blend of nitrates, vitamin C, and bioactive enzymes does inside your arteries. The main engine is raw beet juice. Beets contain one of the highest concentrations of dietary nitrates in the entire produce aisle, more than spinach, celery, or lettuce. When those nitrates touch the bacteria on your tongue, they convert to nitrites. Swallow and stomach acid turns nitrites into nitric oxide. That single gas molecule is the body's fastest vasodilator. It tells smooth muscle in artery walls to relax right now. Ultrasound studies show measurable vessel widening within 7 minutes of a strong beet shot. But beets alone aren't enough. You need a catalyst to speed conversion and protect nitric oxide from breaking down. Enter fresh lemon juice. Its vitamin C stabilizes nitric oxide and recycles it, giving each molecule a longer window to work. Researchers at the University of Exeter found athletes who combined citrus with beet juice raised their nitric oxide twice as high as beet juice alone. Next, a thin slice of raw ginger. Gingerols act like natural ACE inhibitors, easing tension in artery walls and thinning the blood slightly so it moves with less resistance. They also enhance enzyme activity in saliva, pushing nitrate to nitrite conversion faster. Patients who add ginger report warmer fingertips in under 10 minutes, a sign capillaries are opening. To finish, icy mineral water. Temperature isn't a gimmick. Cold triggers mild surface vasoconstriction. When the chilled drink hits your stomach, your body rebounds by dilating deeper vessels to maintain core warmth. That rebound pairs with the nitric oxide surge, producing a noticeable rush of heat through the limbs. Carbonation adds a small burst of carbon dioxide, which further relaxes vascular smooth muscle. The recipe is simple but precise. Half a raw beet, scrubbed, sliced, and blended. Juice of half a lemon. 1 coin-sized slice of fresh ginger. 6 ounces of cold, sparkling mineral water. Blend until smooth, strain if desired, pour over 2 ice cubes and sip, don't gulp, so tongue bacteria have time to work. Why does it outperform pills? Medications like sildenafil wait for sexual stimulus. Nitrates supply the missing gas immediately. Blood pressure tablets lower pressure but don't boost flow speed. This drink does both. It lowers resistance and raises volume. Safety matters. Natural nitrates are gentle, but anyone on blood thinners or with kidney stones should clear high oxalate foods like beets with their physician. For most men, the only side effect is beet tread urine, harmless and temporary. Combine these ingredients, and you create chemistry your body still remembers from youth. Fast nitric oxide, wide vessels, strong pulse. In 7 minutes your hands warm, your mind sharpens, and blood moves where life feels richest. In the next segment, I'll show you exactly how to prepare this drink so every nitrate and antioxidant stays intact from cutting board to glass. The cold drink recipe, step by step. You don't need bar equipment or exotic powders. Everything here is fresh, cheap, and waiting at the supermarket. The goal is to preserve nitrates, add catalysts, and keep the drink cold enough to trigger that rebound dilation without numbing your taste buds. 1. Choose the beet. Pick a firm, deep red beet roughly the size of a tennis ball. Deeper color means higher nitrate density. Scrub off soil, trim the ends, but leave the thin skin. It holds extra minerals that support nitric oxide enzymes. 2. Slice for maximum surface. Cut the beet into thin coins, 1/8 of an inch each. Thin slices expose more nitrate to your tongue bacteria when you later blend and sip. Thicker chunks trap the good stuff in cellulose you can't break down fast. 3. Pre-activate with citrus. Juice half a fresh lemon over the beet slices in a bowl. Toss gently and let them sit 3 minutes. The acid begins converting plant nitrate to nitrite before the first sip touches your tongue, shaving valuable seconds off the 7-minute window. 4. Add the ginger catalyst. Peel a coin-sized slice of raw ginger. Mince it finely. Smaller pieces release more gingerol, which thins blood and speeds gastric emptying so nitrite hits your bloodstream sooner. Drop the mince into the bowl with beet and lemon. 5. Blend cold, not warm. Tip everything into a high-speed blender. Add 6 ounces of chilled, sparkling mineral water. Look for at least 150 mg of magnesium and calcium combined on the label. Minerals buffer stomach acid, stabilizing nitric oxide. Blend 30 seconds. Any longer, friction warms the mix and degrades nitrates. 6. Strain lightly. Pour through a mesh sieve into a glass packed with 2 ice cubes. Press pulp with a spoon, but don't squeeze every drop. Overly fine particles slow absorption. Discard the pulp or save it for soup. Its nitrates are already extracted. 7. Sip, don't shoot. Hold each mouthful for 5 seconds, swishing gently so tongue bacteria finish converting nitrite. Swallow, breathe slowly. You may feel a soft flush behind the ears by the 3rd sip. That's vessels opening. Timing and storage. Drink on an empty stomach, ideally mid-morning or 2 hours before activity. Nitric oxide peaks between the 7th and 20th minute, plateaus for 2 hours and gradually fades by 6. Prepare fresh each time. Refrigerated beet juice loses half its nitrates in 48 hours, and bottled brands are pasteurized, destroying enzymes you need for the conversion. Taste tweaks without penalty. If the earthy punch bothers you, add 4 frozen raspberries. They sweeten while supplying extra vitamin C and anthocyanins. Both protect nitric oxide. Avoid honey or sugar. Glucose competes with nitrate pathways and blunt the vascular response. Safety check. Monitor blood pressure the first week. If you're on antihypertensive medication, numbers may drop further. Pink urine is normal. Skip this drink the day before a colonoscopy. Beet pigments look like blood to the uninformed eye. With these steps, you've built a near-instant circulatory switch. Nitrate ignition, citrus accelerator, ginger catalyst, mineral stabilizer, cold rebound. In the next section, we'll map exactly what sensations to watch for minute by minute, and simple moves to stretch that window of boosted flow through the rest of your day. When you'll feel it and what to watch for. If you've followed the preparation steps correctly, fresh beet, fresh lemon, a slice of raw ginger, and cold mineral water, your body should begin responding in minutes. This isn't theoretical. It's chemistry you can feel, and the timeline is surprisingly precise for most men over 60. Minute 13, warming begins. Within the first few sips, blood flow begins to shift. Nitrites are already forming in the saliva and entering the bloodstream. If you're sipping slowly and letting the juice coat your tongue, your oral bacteria are doing their job. By the third minute, many men feel a subtle warming sensation in the fingers or toes, especially if you've been dealing with cold extremities. That's capillaries waking up. Blood is reaching places that have been undersupplied for months or even years. Minute 47, nitric oxide peak begins. Around minute 7, nitric oxide conversion hits a sharp rise. This is when blood vessels start dilating significantly. You might feel a slight flutter in the chest, not discomfort, just a gentle awareness of your heart beating a little more efficiently. If you're seated, your hands may feel warmer, your face might flush lightly, or your head may feel clearer. Some describe it as mental brightness, as if someone lifted a curtain from their thinking. You may also notice improved breathing, nostrils opening, chest expanding more easily. That's not placebo. Nitric oxide also improves oxygen uptake in the lungs. More oxygen in the blood means more fuel for your brain and muscles. Even sitting still, your body is now operating on better circulation. Minute 10:30, performance boost. This is the window where many men experience the most noticeable benefits. If you walk during this period, even just around the house, you might feel a little more spring in your step. Some report less stiffness in their knees or a smoother arm swing. If you're planning intimacy, this is also your optimal time. Blood flow has increased in the pelvic region, vessels are dilated, and responsiveness is usually higher with less effort. Mentally, expect calm alertness. Unlike caffeine, which stimulates your adrenal system, nitric oxide creates clarity without tension. You'll feel more present. I've had patients describe feeling more patient during conversations, more emotionally in tune, even more motivated to finish tasks they usually avoid. Minute 30, 120, sustained effect. For the next hour or two, circulation remains elevated. During this period, tasks that usually feel tiring may come easier. Walking, climbing stairs, reading, even deep thinking. Many men feel a noticeable difference in stamina, particularly if they pair the drink with movement. Light physical activity during this window helps push nutrient-rich blood deeper into muscles and joints. After 2 hours, gradual taper. From this point on, nitric oxide levels begin to decline. Some men report a gentle energy drop, while others feel stable but calmer. To stretch the benefits, drink water, stay active, or eat nitrate-rich greens like arugula or celery. Deep breathing exercises during this time can also maintain dilation. Signs the drink is working. Warm hands and feet when they're usually cold. Easier breathing through the nose. Brighter, clearer thinking. Improved stamina for short walks or stairs. Increased sensitivity and performance during intimacy. Less joint stiffness, especially in the morning. More emotional balance or mental steadiness. If you don't feel any of these in the first few trials, check your preparation. Pre-cut, cooked, or stored beet juice may not contain enough active nitrate. Rinse-free mouthwash can destroy oral bacteria and block the conversion, and gulping the drink without swishing minimizes effectiveness. When done right, this one drink becomes more than a supplement. It's a daily tool to restore a natural function your body still remembers, but no longer builds on its own. And what begins in 7 minutes often improves the next 7 hours. In the final section, I'll walk you through a few simple cautions, long-term tips, and how to track your own progress, so this becomes a sustainable habit, not a short-lived fix. Cautions, tips, and long-term use. This drink works fast, there's no question about that. But like any tool, it needs to be used wisely, especially for men over 60. You're not just after a one-time boost. You want lasting results, better blood flow every day, sharper thinking, and stronger performance with less effort. That means understanding the boundaries, building consistency, and knowing how to track what actually improves. Let's start with the cautions. If you're currently on blood pressure medication, especially beta blockers or nitrates, you need to monitor your numbers closely. The beet lemon ginger drink naturally lowers blood pressure. Combined with medications, it may reduce it too far. I've seen men drop 15 points systolic within 30 minutes of drinking it, which sounds good, until they get lightheaded standing up. If you're on medication, test your pressure before and after the first few uses. If your numbers fall below 100 systolic or you feel dizzy, scale back and consult your doctor. Men with a history of kidney stones also need to be cautious. Beets are high in oxalates, which can contribute to calcium oxalate stones in sensitive individuals. If you've never had a stone, a few servings per week likely won't hurt. But if you've had stones in the past, consider rotating your nitrate sources. Use arugula, spinach, celery, or bok choy instead. They also boost nitric oxide but carry less risk. Avoid using antibacterial mouthwash within 2 hours before or after drinking this. It kills the oral bacteria that convert nitrates into usable nitrites. Without that step, the entire nitric oxide process is blunted. The same goes for chewing gum loaded with strong menthol or artificial sweeteners. They alter the oral microbiome and reduce conversion efficiency. Now, onto tips for making this a long-term habit. 1. Pair the drink with movement. Even a 5-minute walk after drinking it helps push oxygen-rich blood to your limbs and brain. The drink improves flow. Movement directs that flow where it's needed. 2. Keep your ingredients fresh. Store beets in the fridge, unpeeled in a breathable bag. Buy ginger weekly. Use real lemons, not bottled juice. It lacks the enzymes and vitamin C needed for conversion. Mineral water should be high in magnesium and calcium. Avoid flavored versions with additives. 3. Don't overuse it. Daily use is safe for most men, but 4-5 days per week is plenty. Take rest days. Let your body reset and respond again fully when you reintroduce it. Some men rotate their routine: beets 3 days a week, arugula-based salad 2 days, and a break on weekends. 4. Track your results. Don't rely only on how you feel. Buy a basic blood pressure monitor and track your readings before and after drinking the blend. Watch your resting heart rate. Are your fingers warmer? Do you wake less at night? Are your thoughts clearer in the morning? Small trends build confidence and help you know when it's working. 5. Stack it with other circulation habits. This drink is not a substitute for hydration, clean eating, or movement. But when combined with walking, strength training, omega-3s, and deep sleep, it becomes a force multiplier. It's your spark plug, not the whole engine. Many of my patients turn this into a small ritual. They prepare the drink mid-morning, step outside for fresh air, take a 5-minute walk while sipping it slowly, and sit with calm breathing for 10 minutes. That's 15 minutes that set the tone for clearer blood, better function, and sharper mood every day. If you're over 60 and want to stay active, warm, and fully present, your body needs support it no longer makes on its own. But it doesn't need extreme interventions. Sometimes it just needs the right signals in the form of food, movement, and oxygen. This drink is one of those signals. It's simple, powerful, and proven. Your job now: use it consistently, use it wisely, and use it with purpose. Because good blood flow isn't just about performance. It's about staying fully alive in every sense of the word. You now know how one fresh beet, half a lemon, a slice of ginger, and cold mineral water can wake up every artery you own. Pick a day this week, make the drink, and walk for 5 minutes while you sip. Then share in the comments what you felt first: warm hands, clearer thinking, or stronger drive. If this guide helped you, like the video and subscribe to Glowing Age. Your support lets me create more doctor-led lessons that keep every man over 60 strong, sharp, and fully alive.